Raynaud phenomenon. So when this condition is not associated with any other disease, it is called Raynaud disease. And this is purely mediated by an excess of alpha-2 receptors on the vasculature in a patient's digits. So if you think this is someone's hand, I know it's not the best hand out there, if we're talking about the digital arteries that are present in the peripheral segments of someone's extremities, and particularly in their hands. Now, think about this. Remember, we have our synaptic cleft. So this is our synapse. And then we have vesicles, and they release neurotransmitters. And in this situation, we need to think about something like norepinephrine or epi. Now, I know that we classically think about alpha-2 receptors as part of a negative feedback mechanism where they are sitting on the presynaptic terminal of a synapse, which actually downregulators of norepinephrine release. But there's actually an abundant amount of alpha-2 receptors also on the postsynaptic side, particularly on vascular smooth muscle cells. So if you stimulate alpha-2 receptors on vascular smooth muscle cells, you obviously get vasoconstriction. So what is pretty interesting is that when we get cold, so when we have an extensive low temperature, there's a movement of these alpha-2 receptors from the Golgi apparatus, which is where they're stored, and they're taken to the vascular smooth muscle surface. So now that we're cold and we have exposed more of these alpha-2 receptors from the Golgi apparatus on the vascular smooth muscle cell membrane surface, remember, these vascular smooth muscle cells line the vasculature that provides our skin. And we get that intense vasoconstriction because when we're cold, we want to prevent the loss of heat from superficial vessels like our digital arteries. Now, some people have excessive stress responses that have this similar movement of receptors from the Golgi to the surface of the vascular smooth muscle cell plasma membrane. So it moves within the Golgi of the vascular smooth muscle cell to the surface. And now we have an increased number of alpha-2 receptors. And if someone that has an excessive response and has an excessive amount of alpha-2 receptors move to the surface of their vascular smooth muscle cells, they get a lot of vasoconstriction, and that really decreases their blood flow to their digits, right? Especially the digital capillaries. So as you can see in this image, the red arrow highlights the blue discoloration from the decreased blood flow. Now, Raynaud disease, when in association with another situation such as lupus, CREST syndrome, or a mixed connective tissue disease, these changes occur due to vascular compromise because all of these diseases have antibody-mediated vascular damage associated with them. The damage to the vessels disrupts the normal regulation of these alpha-2 receptors and endothelial cell function. Now, let's focus in on another high-yield aspect. Let's talk about which antibody is classically associated with each of these diseases. With systemic lupus erythematosus, you always think of double-stranded DNA, and anti-Smith. With CREST syndrome, we like to think about anti-SCL70 antibodies. And with a mixed connective tissue disease, we like to think about anti-U1RNP antibody. Excellent. Let's keep on pushing. Before we start talking about vascular tumors and looking at the images, we need to understand that most benign tumors usually are well developed. So let's write that. So benign are usually well-developed tumors. They're trying to be normal cells, except they just kind of messed up a little bit. For example, they usually have well-developed vasculature, which can actually hold blood in blood vessels and has appropriate drainage with lymph channels, with normal endothelial cells inside of both of them. On the other hand, scary malignant tumors do not care about looking about the native tissue. They are poorly developed because all they care about is replicating and being malignant. They do not care about forming well-organized vessels, either lymphatic or venous or arterial. They just proliferate like crazy, and they usually outgrow their blood supply, which is a lot of reason why tumors in general necrose and cause problems with an inflammatory-like response, because the body is trying to not only attack the tumor, but then there's additional necrosis on top of that. So let's talk about this little guy, strawberry hemangioma. So by just looking at the word hemangioma, we can figure out something about these guys. So heme is Greek for blood, and angio obviously means vessel, and oma means mass. So this is a blood vessel mass. So hemangiomas are just composed of abnormal vessels filled with blood that usually appear at birth on the head or neck, and sometimes have a visceral involvement such as hepatic involvement. Most of these guys regress spontaneously and do not progress to a malignant lesion. So a strawberry hemangioma is just a type of capillary hemangioma. So again, capillary, that has an overlying epithelium. As you can see, there's a very small skin-like covering, and it is slightly elevated. As you can see, it has a raised border, and it sits a little bit above the skin. This kind of looks like a strawberry if you were to draw some leaves here. Hence the name strawberry hemangioma. But really, it's called strawberry hemangioma due to the general presence and coloration of it. I just like to think about it in that mind with this particular image. They're all not going to be in the form of a strawberry. But if you use your imagination, you can kind of come up with whichever image of a strawberry you'd like. It is a benign tumor. That's the most important thing on this slide. It is benign because it kind of looks like normal vessels. Benign tumors try to make normal tissue. They will grow up until benign strawberry hemangiomas try to make normal tissue, and that's why they look like slightly abnormal vessels. They will grow up until age 5 through 8, and then spontaneously regress. So what about a cherry hemangioma? Just going through the fruit aisle at Publix, or whichever store that you shop for your groceries at. Now, this is just like a strawberry hemangioma, except that they are usually much smaller, so decrease in size, and they appear in people that are much older, so increase in age, usually in elderly, and they do not regress. I like to think about it as strawberries grow on the ground, and children are very small and low to the ground. Usually, children will continue to grow until 5 to 8, until they no longer want to pick strawberries. Cherries are in trees, and only older people can get them. They're obviously of smaller size compared to a strawberry, and they do not regress, because the tree is old just like the person. So they have progressed to a long period of time, and they'll be around for a long time, just like that tree and old person. So let's think about another one. A pyogenic granuloma. This, again, is a type of capillary hemangioma that is stimulated and created due to a lot of angiogenic factors. So usually, these are released in response to some sort of trauma, which you could expect neovascularization, or the formation of vessels in the healing response. And they can also occur as a response to pregnancy, which is also an environment in which there is a lot of neovascularization. There's a development of another human being, perfusion of a placenta, and that is how I correlate those two and put them together in my mind. So both of these are environments in which you have a lot of creation of new vessels. So it's kind of like an environment in which a lot of angiogenic factors are circulating. If you can think about it in another way, you can say that a lot of angiogenic substances from the placenta are stimulating maternal vasculature to grow. And this is the same concept behind there are a lot of vasoconstrictive substances that cause the mother problems in things such as preeclampsia. So that's another way to kind of generally think about how pregnancy can influence the fetus or the mother. Now, this name is a misnomer because pyogenic should make you think of pus, right? But there is none. There is no infection. It is described as a polypoid structure, normally, because it looks like a polyp. And it usually looks like a polyp because it is usually a mass sitting on a stalk. And whenever you have a stalk providing blood flow, there's a blood vessel traveling through this very small stalk trying to provide this growing tumor. And that is why these are common to ulcerate and bleed. In addition to the fact that they're making weaker vessels because they're stimulated to do so all the time. Now when you have this chronic process of bleeding, ulcerating, repair, then you get a lot of granulation or repairing tissue. And this is why it looks like a granuloma. And the chronic bleeding and ulcerating kind of led to the name of pyogenic, which is inflammatory or pus looking like. But it is not the true situation going on. There's no infection. Now what about a cystic hygroma? The name cystic hygroma should make us feel comfortable about what this structure actually means. So hygro is Greek for moist. Oma means mass. And cystic obviously tells us that it's a cyst-like structure. It's round, full of fluid or something, potentially full of whatever we want it to. The moist component comes from the fact that it is usually a tumor of lymphatic vessels. Again, it is a mass of tumor of lymphatic vessels. These contain a bunch of fluid and can appear like a big, large cyst. It is classically associated with boom, 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 high yield that you have to know this one, Turner syndrome. Now what about a glomus tumor? Glomus tumors are really painful, benign growths. I'm talking super painful. I saw a patient with one and it was excruciating just to watch them remove it until they put them under local anesthesia and numb that area. These are really painful growths derived from the modified smooth muscle cells that make up the thermoregulatory structure of a glomus body. So it makes sense, right? If we have abnormal proliferation within the glomus body, we get a glomus tumor. Now, what exactly is a glomus body? It's basically like an arteriovenous shunt. So you have, this is your artery and this is your vein. It helps to shunt blood this way. If, for example, this is our skin surface and we're trying to not lose heat. So we don't want blood going this way and blood going this way because we need to conserve heat and we will dissipate heat if there's a significant amount of blood entering the skin vasculature. So the glomus body is a modified smooth muscle cell that sits right here at the arteriovenous shunt location that we naturally have in our body and will constrict to help shunt blood away from the capillary network so that we do not dissipate heat when we are cold. Now this makes a lot of sense that the glomus tumors occur in places where we need to prevent excess heat loss, where they normally are, right? A glomus body is a thermoregulatory structure. So you see glomus tumors in these areas where we need to regulate a bunch of heat that is lost insensibly. So the fingers, the wrist, the forearm, and the foot. It can be very painful because glomus bodies are highly innervated because they have to be able to sense temperatures in order for the nervous system to be able to directly stimulate these bodies for acute changes and accurate thermoregulation. Now, this image here shows the smooth muscle cells and the cavernous places that are within the vasculature of the tumor because it's trying to recreate what a glomus body would normally look like. So this is a benign tumor. So you can see here these caverns that are kind of sort of like abnormal vessels. And you can see here there's a smooth muscle cell. Again, glomus bodies are modified smooth muscle cells. So these tumors are trying to resemble the normal architecture of the tissue. It's just slightly abnormal. It's a benign mass. Now, one of my favorites is bacillary angiomatosis, talked about all the time. These are vascular proliferations caused by two species of gram-negative bacilli. One of those is obviously Bartonella, but which one? Henselae, which is associated with what disease? Cat scratch. And also Bartonella quintana, which is transmitted by what? The human louse or lice, whichever one you want to say. Now, this was obviously first discovered in AIDS patients, and that's why we think about it, right? So, or in general, an immunocompromised individual. What happens is that the bacteria stimulate the release of something called hypoxia-inducible factor. So in both of these diseases, there is some sort of stimulation that leads to the release of this agent. Now, we've talked about this before, but we need to review what exactly HIF is, or hypoxia-inducible factor. It is a very potent transcription factor that stimulates the production of vascular endothelial growth factor, or VEGF. Now, what does VEGF do? Well, vascular endothelial growth factor should obviously do something to make vessels and endothelial cells proliferate. And that's exactly what it does. It leads to the proliferation of vessels and endothelial cells. Let's actually look at this. How hypoxia-inducible factor production is actually leading to these changes that we see in bacillary angiomatosis. So you can see here, it's also trying to form vascular channels with these kind of abnormal cells surrounding them. They have very highly dense nuclei. They're large basophilic cells. This image shows how this is trying to resemble vascular channels, but the endothelial cells are all messed up. They have prominent nuclear atypia and mitoses because they're being stimulated to grow and divide constantly. Now, what about an angiosarcoma? So angio, again, means that we're talking about a blood vessel, and sarcoma tells us that we're dealing with a malignant type of tumor from mesenchyme. So mesenchyme and malignant equals sarcoma. So angiosarcoma is a malignant vascular tumor with some sort of mesenchymal component. Now, what are they talking about? These are malignant endothelial cell neoplasms. Just look at the image here. Do you see how instead of being lined with normal endothelial cells, these poorly formed vasculature areas are lined with these very densely, highly bunched, very basophilic, hyperchromatic, or very colored endothelial cells? They are malignant endothelial cells. Normally, remember, we have our endothelial cells lining our vascular channel, and that is exactly what is going on in the situation. So again, very prominent nuclei gives them a very dark color because they take up a lot of stain. The prominent nuclei tell you that they're replicating at a very fast rate. These are very bad, and they occur in the head, neck, breast, and can also occur in the liver. They traditionally are caused by exposure to pesticides with arsenic and thorotrast. Thorotrast is a radioactive contrast agent that no radiologist would ever use these days because they lead to angiosarcoma. The way that arsenic leads to angiosarcoma is that it binds sulfhydryl groups that are found in very important places, such as DNA repair proteins. And obviously arsenic is metabolized in the liver. So this is another way for me to think about the connection between arsenic and angiosarcoma of the liver and how angiosarcoma could present in the liver in general. Arsenic is actually metabolized within the liver into more carcinogenic compounds, which is why there's a particular association with hepatic angiosarcomas. That's kind of a high-yield element, particularly because we can introduce pesticides and confuse you with a potential question about some sort of organophosphate poisoning, when in fact they want to lead you down some sort of presentation of angiosarcoma associated with arsenic being metabolized by the liver and generating an angiosarcoma. Now, thorotrast was an agent that you may not be tested on, but it was a radiotracer used for contrast because it's a very large molecule that can circulate and absorb X-rays. Well, the problem is that the body had a tough time clearing it, so now we have a molecule that has absorbed a bunch of energy in the form of X-rays just swimming around our body. And eventually, when it does break it down, we start to release alpha particles, and alpha particles crash into DNA and they just mess it all up. Remember, alpha particles are very positively charged emissions of energy that go after DNA and cause damage to it. So a radiocontrast dye called thorotrast and arsenic are some of the main culprits for angiosarcoma.